Talk to us about extended sperm search and microfreeze.
Got it. So one of the things that we see with men that can be very frustrating for the couple is that a man has what we call cryptospermia, meaning occasionally you see one sperm, occasionally you don't. Even when you spin it down, you see one or two, but obviously that's not usually, it's not predictable. They don't always have something. And the day of an in vitro fertilization cycle, you may not find anything. So the Israelis actually came up with this technology. It was very cool. And we're actually, for some reason, the only people who've brought it to the States. And what you do is you spin it down, but then you take 6 or 8 hours to look through it in microdroplets. And that's the first part. That's the extended sperm search. But then, you know, what happens if you find them? What do you do with them? But then they came up with a way of putting them into microdroplets on a specialized slide and freezing them in a special way that they actually are easy to find and have a high recovery rate. So with men who have like no sperm, you know, cryptospermia, very, very few, we have almost 100% chance of finding enough sperm for them to then proceed with an IVF without having to do a testicular sperm extraction.
So now we have clients all over, you know, America. What happens if some of our clients don't know that this procedure exists?
Well, yeah.
Is that even, can they come to you?
Yes. So the interesting thing is because the sperm can be frozen. I mean, I think we are the first ones in the United States, but I'm hoping that it spreads because in general, I care more about the fertility than, you know, having it all done in my office. But this is one of the technologies that can absolutely, and we have people coming from all over the country to us to do this. And then since we've frozen it, we can send it back with them. Locally, we've actually been doing some of them fresh and just sending them on these little slides, the fresh sperm, which was really fun.
Can people, I'm in Atlanta right now, can I send my sperm to you in FedEx and you take care of it, or it has to be done?
No, they have to come and produce a specimen here.
Interesting. And then you can ship it back.
Then we can ship it back. Yeah, or whatever.
Interesting.
Yeah.
Interesting.
The other thing that we do is for the men who have azospermia, which means they have no sperm in the ejaculate, we can also do the ESSM, and about 40% of those men, 44% to be precise, will actually have low numbers of sperm that we can freeze, and that prevents us from having to go in and doing an invasive biopsy to get the sperm.
Tell me more about that. What happens if this doesn't work for them? What is the more invasive procedure?
Right, so working backwards. So if we talk about men with azospermia. So azospermia means that you don't have any sperm in the ejaculate. And of course, if you do a sophisticated semen analysis, you should wash it down. You should spin it down and then look for it there. But let's say you still don't have anything. You do your evaluation to make sure there's nothing genetic going on. Is there anything you can do hormonally to reverse it? But if you're still, we don't have an answer or there's nothing we can do to reverse it, then the next step can be the ESSM, where basically you abstain. It's a pain in the neck. You abstain for 10 days, and then you spin it down and look. And sometimes we find the sperm, and those can be used for an IVF. If you don't find sperm in that, you have two choices. One is a sperm mapping, where you can do in the office in a non-invasive or relatively not invasive procedure where you put a bunch of needles in the testis. It sounds terrible, but actually we've had guys sleep right through it. And you sort of map where the little locations for the sperm would be. If you don't find anything there, or you can skip that step and go right to a microscopic testicular sperm extraction, where you go in and you look for sperm in individual tubules. Usually that's combined with an in vitro fertilization, so they can take those sperm and inject them directly into the eggs.
Now, are they sleeping during this? Or are they awake?
So yes, depends on the procedure. So the sperm mapping, no. The testicular sperm extraction is done in an ambulatory care center with an anesthesiologist, so they are sleeping through that.
Got it. Wow, that's pretty interesting.
It's pretty amazing.
We're missing about ESSM. How'd you find out about it?
So actually, what was interesting is one of the infertility groups that serve the ultra-Orthodox, called A-Time, had been doing it on their patients in Israel. They've been flying the patients to Israel, and they asked us if we could start it here. And I was like, yeah, this is brilliant, and I should have come up with it myself, but they were very helpful. So that's how it came to us. It was sort of interesting, actually.
Amazing. Are you training anybody else right now?
So no one's asked. We have two of our, we have two people in our lab who do it, but the Israelis will train whoever. And they've been training people in India and a bunch of different countries in the world. So it is spreading, and I think it will become the standard of care.
Amazing. Well, thanks.